Our last speaker, Dr. Alexis Chávez, Medical Director at the Trevor Project, will speak about the care needs for LGBTQ youth and share examples of initiatives outside the doctor's office that have lasting impacts on youth and communities. The Trevor Project is the nation's leading organization serving LGBTQ+ youth in the areas of suicide prevention and crisis intervention. At Trevor, Alexis works to improve care for these youth and to ensure that all of Trevor's services and programs are evidence-based and up to date with the latest research. We are pleased that Alexis is with us today to share her work. Alexis?
Hi, and thank you for that introduction. It's a pleasure to be here talking with all of you. So the first thing that I would like to address is the need for data on LGBTQ youth and especially their mental health. Because if we don't have data that helps us understand what is the current state and what are the factors that are affecting youth mental health, then we can't work to understand how we can improve that mental health. And we know that overall, when barriers are put in place that prevent data collection, that is a form of discrimination against youth. So, an introduction to our first national survey on LGBTQ youth mental health that we conducted last year and published the results of this year. I would encourage all of you to check out the results from the national survey in full. It has its own microsite. But this survey has helped us understand what are some of the unique needs of LGBTQ youth. To help understand how the survey was conducted, it was 34,000 youth that we contacted, none of which we contacted directly through the Trevor Project in order to best prevent any sort of bias on our part. So the data that currently exists on trans youth especially is fairly lacking. There's not much nationwide data on any of the risk factors and outcomes. The CDC YRBS does have some questions on gender identity, but I think that there is certainly a move in which we can make it even more inclusive and even more comprehensive. And it's still lacking a bit geographically in terms of how much we can capture. So some of the key results from our survey have found a number of the ways the mental health of LGBTQ youth is significantly impaired by the discrimination that they're facing every day. We know from the research that the discrimination that they face directly results in these numbers that we see, with the increased risk of suicide, of depression, and of any of these conditions. There are ways in which it's been tied to the constant stress, to the lack of affirmation of the basic aspects of themselves as a person, especially with regards to their sexual orientation or their gender identity. We know that LGBTQ youth experience all the same struggles that non-LGBTQ youth do, and they additionally face struggles related to their sexual orientation and their gender identity. So, with regard to suicide, 39% of youth have seriously considered attempting suicide in the past 12 months, and that number is even higher when we're talking about transgender and non-binary youth. So there are also particularly high numbers of youth that have reported feeling sad or hopeless for at least 2 weeks over the past year. We understand that there are impacts of the current political climate. Not only do a number of youth feel that it impacts their mental health, we have seen real-time results Immediately following the most recent presidential election, we saw a large spike in our call volume. It very quickly doubled. After tweets about the transgender military ban, we again saw an enormous spike in our call volume. And really we see that over time, there are measurable impacts of all of this political environment, that if their basic rights are being debated, whether they can use the bathroom that corresponds to their gender identity. We know that about half of all youth have reported that they have had struggles in their schools using the bathroom that corresponds to their gender identity. And with regards to the bathroom, there's also been case studies reported of recurrent urinary tract infections, of hospitalization due to these long-term chronic urinary problems because people were not allowed to use any bathroom at school that corresponds to their gender identity. So we know that not only is their mental health affected, we have measurable impacts in how their physical health is as well. We also know that conversion efforts, so-called conversion therapy, is still happening to youth even today. We have found direct correlations between those youth who have experienced conversion therapy and those and their reports of suicidal ideation or even suicide attempts. We know that this happens across the nation in every state, at least as recently the data that we've last looked at was from 2015. So when we hear lawmakers arguing that these don't happen, that it's not important, we really have to push back on that and look at how it is currently and ongoing affecting our LGBTQ youth. So the link between suicide attempts and conversion therapy, as I mentioned, is starting to be elucidated. There have been 2 reports that have come out over the past couple months that have correlated the links both between conversion efforts for sexual orientation and also those for gender identity, understanding that both of these are harmful. And it's not just conversion therapy let me rephrase that. Conversion therapy is not only in its most extreme forms. We know that in its most extreme forms, where it is akin to torture, I think that it's very easy for people to understand how that's harmful. But we also know that any attempts to change a youth's sexual orientation or gender identity can have lasting harmful effects. We know that many youth have experienced discrimination due to their sexual orientation or gender identity. I think that although there's a lot more discussion that's being had overall about movement toward equality for LGBTQ youth, I think that it's very clear that we're really not at this point yet. And as I mentioned earlier, over half of trans and non-binary youth have been discouraged from using a bathroom that corresponds to their gender identity. So youth, when they're experiencing this discrimination every day, they've made it very clear that it's important for them to have someone they can reach out to that understands what they're going through. There are many youth who feel it's especially important for an organization to have clear focus on LGBTQ youth, such as we have here at the Trevor Project. I think that there are ways in which other organizations incorporate LGBTQ competence, as we've heard about, there are ways that providers are being trained, and we think that this is so helpful and so important because youth need to know when they're reaching out to somebody that they're not going to be subjected to conversion efforts, that their provider is going to have a holistic understanding about development of gender identity, of development of sexual orientation, and how that might change throughout the lifespan. Another thing that we've noticed is that youth more today are identifying with so many different terms for sexual orientation and gender identity that there's such a diversity in expression that we really are hearing so much more and realizing all the ways that people can exist. So with regard to some of the future directions of data collection, the first is to further exploring other interactions of health factors. Some of this is how youth, LGBTQ youth, are particularly affected by homelessness. We know that about 40% of all homeless youth identify as LGBTQ. When we're talking about trans youth, when we're talking about youth of color, then the numbers are even higher. There are particular challenges that they're going to face because of this in terms of how can they be placed into the appropriate foster care system or other supports. We also want to look at the effect that substance use is having on LGBTQ youth. Part of the problem with identifying exactly how, let's say, the opioid crisis affects our population is that we don't have clear data collection on what happens for the deceased. So if someone is the victim of a hate crime or if someone has died to an opioid overdose, currently there are no widespread efforts to collect sexual orientation and gender identity data from those deceased. We're making an effort, and we're happy to say that LA County has been the first to sign on to start collecting this data so that we can better characterize how so many different things are affecting our young people. Outside of research and data collection, I think it's important to think about what are the ways that we can support the mental health of all young people outside of the healthcare system. Ideally, every young person would be connected with a primary care provider, with a mental health provider, whether that's a psychiatrist, a psychologist, a therapist, whatever that means to them. However, we know that that can be a problem for many people for a number of different reasons, whether it's access to transportation, whether it's financial difficulties, whether it's where they're living in the country, whether it's they have access to providers but maybe not to LGBTQ competent providers. For any number of different reasons, people are not able to get complete access to everything that would be helpful. However, we can think about ways that we can support them regardless. One of the ways that we can support them is in the schools. At Trevor here, we've worked with various national organizations, including the American Foundation for Suicide Prevention, the National Association for School Counselors, to come up with what we've called a model school policy. This gives examples of what every school could implement for best suicide prevention practices. This also includes how to be aware of those with unique needs, such as the LGBTQ population. I'll talk a bit more on the model school policy in a second. Also, we have the lifeguard workshop, which is a way for us to help youth identify their own emotions and feelings, when to reach out, when to recognize both in themselves and their peers when someone is struggling. We often know that youth are so much more tuned into the well-being of each other, oftentimes much before adults, teachers, their parents might know. If we can get youth to help be lifeguards for each other and to help support each other, to encourage reaching out to a trusted adult, that's another way that we can have a significant impact. With regards to school policies, we recently did an assessment on New York state policies. And keep in mind, this is just an example of one state. This is by no means unique to New York, but over a third of New York school districts currently don't have any suicide prevention policy. In fact, if we think about how many New York state policies incorporate anything about LGBTQ youth, it's a much smaller number. Only 2% of the policies we looked at specifically talked about that. And that leaves this gap of how LGBTQ youth can get the best care that they need to be supported with their sexual orientation and their gender identity. As an example of another state, from last November, we had looked at how the implementation of suicide prevention policies in school, particularly in California, had affected this. Before there was a policy, statewide bill or law for that, only about 3% of policies included LGBTQ youth. After there was a bill that said that schools should implement suicide prevention policies that incorporate the needs of special groups, 90% of those written afterwards included LGBTQ youth. So we can see the impact that various policy changes might have. In addition to in the schools, we understand that youth are looking for more ways to connect with each other. One of the ways that we are addressing this is with Trevor Space. It's a social network that's moderated by individuals here at the Trevor Project. So in a way, we are acting as trusted adults that are creating this space where youth can connect with each other to find their communities that they may not have great support for at their own schools. If they don't have a GSA, if there's no one else at their school that they know is out in any particular way. And then also, in addition to social connectedness, we understand that while we would like everyone to have a direct link to a mental health provider at all times, there's a lot of space between those who have nothing and those who have that access, and that's where some things like crisis lines can help fill the space. So we run a 24/7 crisis line that's specifically for LGBTQ youth. Youth can call in, they can chat, or they can text at any time. And the way that we imagine this is that if we continue to incorporate more ways that youth can get access to any sort of support that they need, if we can add this to mental health, if we can add this into the various apps that are being created, CBT apps or mindfulness apps, there are many ways that we can all work together to better improve health.